Hi everybody, this is Dr. Charmaine Johnson from Premier Smile Center. Today we have pretty much all our dental offices put on a mandate that we only provide emergency services to patients now and do not provide any elective services. And so I've had a lot of patients call and ask me numerous questions, and we are more than happy to answer them. We're still answering our phones and seeing emergency patients. But what I wanted to talk a little bit about today was what procedures are considered emergency procedures and what procedures are considered elective. So according to the American Dental Association, an emergency procedure is any procedure where it's considered life-threatening. So something where you have uncontrolled bleeding and you just can't stop it. Anything where you might have some facial trauma, get hit in the face, whatever the case may be, and the bones are broken and it's causing an inability to breathe properly. Something like swelling around the head and neck area that's going to constrict your airway and prevent you from breathing. So those obviously are life-threatening, but there are also some procedures that require urgent dental care. And some of these are basically, they include severe dental infections where the cavity has entered into the nerve of the tooth and there is severe pain. And those cases would require a root canal. It would be wisdom teeth pain. Sometimes the area is swollen and there's infection. It would be something like an extraction you had perhaps last week and it's not healing very well, and now you have a dry socket and you have severe pain from that. It could be any abscess or bacterial infection that's causing swelling or pain around a tooth or around your gum tissue. It could be a broken tooth where either you have pain from it or the broken piece is causing trauma and rubbing up against the gum tissue. Could be, you were playing some sports and a tooth got knocked out, and now we've got to try and put it back in. And then it could also be you have a temporary crown or you have a temporary filling and it's come off, and now you're having a lot of pain because that tooth is no longer covered like it used to before. There are some other emergency procedures that we can also consider besides those which are very obvious. One of them is if you have extensive decay and that decay is causing you pain. Sometimes you have pain to hot and cold and it's getting worse and becoming more constant. So that would be an urgent procedure we would have to take care of. It could be suture removal. So if you had some sutures placed and they're not dissolvable and they're dangling and they just causing irritation, those can be snipped and removed. If you have denture adjustments, if you're a cancer, oncology patient and it's irritating the tissue, or if you need a denture adjustment for something where it's scraping on the tissue and you cannot function and it's causing ulceration. It could also be replacing a temporary filling on a root canal on a patient that is experiencing pain. And then lastly, an orthodontic wire. Sometimes the bracket pops off and the wire is digging into the cheek, and that can be snipped off because otherwise that would cause more problems. What is elective and not an emergency are obvious things like checkup and cleanings, regular fillings and crowns or restorative work, anything cosmetic, and any extractions of teeth that have no symptoms, and any orthodontic treatment. So with that in mind, I hope that this sheds some light on some questions that you might have as to whether your procedures are an emergency or not. Either way, we are here still answering our phone. So if you're not sure, please give us a call and we'll be able to guide you through that. Even if you're not a patient of the office, we're more than happy to answer your questions for you. Our number is 954-566-7479. If there are any people who could benefit from this information, please share this post so that other people can learn from it too. Stay healthy.